Using StepRight is very easy for the patient. After pairing and connecting, the first thing that they're going to do is a simple 14-second calibration. This calibration, you'll see the patient lift the right leg followed by the left leg. What's happening is that the sensors are determining the amount of force that are placed within the environment. This means the type of shoe that they are wearing. Once calibration is complete, you will see that the app automatically succeeds to the next exercise. In this case, and always, it is standing pressure. The importance of standing pressure is to determine the symmetry left to right leg as well as quadrants of the foot. This exercise will show if the person is behind the ankle or on the ball of the foot, or if they're pronating or supinating, all of which means something in regard to their pain or ability to stand equally on both legs. As you will see in this exercise, the patient is standing still. We don't want them moving arms, nor the head. No movement, as little as possible, is best for this exercise. The third exercise in the series is gait analysis. This is simply where the patient has to walk. When using StepRight, you don't have to necessarily walk a straight line, all the way out the door, into your yard, onto a sidewalk. You can do this in the comfort of your home, simply walking back and forth a few steps in your living room, for that matter. The algorithm will pick up that motion, disregard the turning, and simply show the output of the heel to toe strike as the person walks throughout their house. The walking exercises can be set for 1 minute minimum and up to 1 hour as the patient progresses and is able to walk. After standing and walking are completed, the app advances then to the selected exercises for range of motion or force distribution as prescribed by the provider. In this case, it's a knee flexion. The app, as you will see, first takes you automatically to a PhD talking about how to perform the exercises, and the exercises on the screen being performed by a PhD student. This is a clear demonstration of proper technique for doing this particular exercises. You then hit the back button on the app and it advances you to this screen where you will see the 3D animated image. Here you can listen to the verbal cues as well as watch her to be in sync with the exercises pursuant your doctor's orders. In this case here, it is the left leg and 3 repetitions. Once these exercises are complete, you would be asked to hit the continue button to do the exercises on the right leg. Once the right leg is completed, then that exercise is done and you're ready to move on to the next exercise. As noted, with each exercise completed, the app advances you to the next. In this case here, it is a hip abduction, standing, resisted. For the purposes of this exercise, we did not put a rubber band on the subject. This exercise is both a range of motion exercises, and because the patient is standing, it also shows force distribution of the foot that is on the ground. Both measurements tell the provider things about the patient's ability to stand and their range of motion. As you advance through this, you may not want to watch the video repeatedly if you know how to do the exercises, which is okay. You can simply click the back button to advance to resume exercises. Here again, you will see the 3D animated image move in synchronization with the verbal commands. You as the patient would move in sync with those commands that you see and hear on the app. In this case, it's 3 simple hip abductions out to the side. You can see in this case the patient is doing the left leg. Of course, after these 3 exercises are complete on the left leg, you would have the ability to hit the continue button to then do the right leg, as that serves as a comparator for the provider to make clinical judgments. When the entire exercise is complete, click and it's done.